Hi, my name is Britt Spears. I'm a certified prosthetist orthotist and a fellow of the American Academy of Orthotists and Prosthetists. Today we're going to discuss diabetic shoes and foot orthotics, or for brevity's sake we will call them inserts. Diabetic shoes and inserts are for diabetics. You have to be classified as a diabetic to qualify for Medicare and or secondary insurance coverage. Medicare will cover 80% of the cost of diabetic shoes and inserts, and some of your Medicare PPO plans will cover up to 70%. The other percentage is due from you, the patient, or if you have a secondary insurance that will cover the other percentage, then that will cover it. You must be examined by a physician. The physician must denote certain conditions of the foot have occurred, such as calluses, poor circulation, peripheral neuropathy of the feet, to name a few, plus also partial amputation or complete amputation of one of your feet or both feet. If you have both legs amputated, there is no coverage for diabetic shoes and inserts. If you have one leg amputated, they will only cover that one side that you still have a leg and a foot on. Because this is a protective measure for your feet, the diabetic shoes come in certain widths and extra depth. They're not available at shoe stores. You have to come to either a podiatrist office, and not all of them handle diabetic shoes and custom inserts for diabetes, or you have to go to an orthotic and prosthetic provider. Orthotic and prosthetic providers will measure you for those. There are several styles available. They're not all available at the same time. Several times they get back ordered for weeks at a time. Therefore, it's recommended that you pick an alternative pair of shoes. Shoe inserts can either be custom or they can be off the shelf. The majority of patients can utilize an off the shelf, which is heat molded to your foot. However, if you have significant problems with your foot, it's highly recommended to go with custom. They generally will go 3 pair in a year. Being a diabetic, what you want to do and need to do as a protective measure for your feet is to do a self-examination daily. Self-examination utilizes a mirror that has an extension on it that you can handle with your hand, and you can examine the sole of the foot, you can examine the sides of the foot, you can also examine around the heel. The top of the toes need to be examined, as well as the top of the foot in between the toes need to be examined as well. The foot needs to be washed daily with antibacterial soap. Never put lotions on your foot unless otherwise directed by your physician. You will also want to have a professional trim your toenails. You'll want to do this and keep them trimmed at a regular basis. You're going to want to wear loose fitting socks because, as you may or may not know, diabetes constricts the small blood vessels by clogging them up. So all of your small blood vessels, especially on your lower extremities, end up having less circulation. So diabetic socks are recommended. They are loose fitting. They're available in some stores such as Walmart, but you can get them at your podiatrist or your orthotic and prosthetic provider. The rules for Medicare coverage is that you have to go to your physician to get your foot examined. He has to denote in his progress notes that you have diabetes mellitus. He also has to denote certain conditions and have a recommendation of a course of treatment which will include diabetic shoes and foot inserts. Then he will have to refer you to either a podiatrist or an orthotic and prosthetic provider. Once you go to them, then they will measure your foot or feet for your diabetic shoes, and they will also determine and agree with the physician on whether custom or off-the-shelf insoles will be required. As stated earlier, you will want to go ahead and pick an alternative pair of shoes as well. Then we have to send off to your physician that is handling your diabetes a detailed prescription. The physician has to sign this prescription and get it back. A lot of times the biggest holdup for us to be able to provide you with your diabetic shoes and inserts is awaiting the paperwork. Once the paperwork comes back and everything is approved, then we order the shoes. Most diabetic companies that provide the shoes, such as podiatrists and orthotic and prosthetic providers, do not have them on the shelf, as there is such a large array of sizes as well as styles. And as stated earlier, shoe stores do not have diabetic shoes and inserts, nor can they provide you with your Medicare coverage or private insurance coverage. Once we receive those, we will try them on your feet. It's not uncommon to find that the shoes do not fit as well as we predicted that they would, so sometimes you have to reorder them. We are in the profession of taking care of diabetes and diabetic feet, so it is well worth the time for us to do a very good job. If they are custom insoles, it can take up to an hour to fit these. It usually on the off-the-shelf variety of inserts, they generally will take about 15 minutes for the fitting process of that. Diabetic shoes come in a lot of different styles and sizes. Till next time, Britt Spears, take care.